Hello, and welcome to Oklahoma Wellness and Weight Loss. I am Dr. Blake Kelly, and you will be meeting with either myself or Dr. Holman today. I would like to cover a lot of ground quickly as to mechanisms of action of the drug, side effects, this, that, and the other. So I'm going to speak really fast. If you'd like to review this further, we're going to make it available on our website, or we can send you the video. So this medication, it's not simply to be thought of as a weight loss medication. It's revolutionary, and I really think this is going to be a turning point in the history of medicine. We'll look back in 10 years and see a lot of trends in high blood pressure, strokes, heart attacks, all these kinds of things that are related to unhealthy lifestyles, and we'll see the trend that has been going upwards for several decades begin to plateau and then begin to go the other way. So it's a very exciting time in society in general. We're in a very huge renaissance right now with AI and robots, and medicine is no different. Major renaissance, and this drug is going to be a big part of that. So, okay, number one, this is a compounded version of the pharmaceutical product, and the reason that we can use a compounded product, because it's not generic, okay, so it's still on patent, is that there's a drug shortage, and that is the only reason. So we expect the drug shortage to last into 2026, if not longer. When that drug shortage is over, we will have to use the standard medication through the pharmacy. But until then, we can do compounded. And for decades, we have used compounded medications. And in certain areas like hormones, especially female hormones, compounded medications have been superior to traditional medications. And the compounding pharmacies are FDA regulated. The manufacturing plants are overseas. They are regulated as well. So we've had compounded medications around for a long time, and they have to meet strict standards just like the regular pharmaceutical industry. So there's nothing inferior most of the time with compounded medications. Many times they're superior. To contrast that with pirated medications or fakes, and there's a lot of that going on the internet. It will look like a regular product pen, but sold at a fraction of the price, and there's no telling what's in there. If anything, it's probably going to be a very diluted version with minimal effectiveness. So we're not dealing with pirated stuff. So, okay, and number two, let's get into the mechanism of action. It primarily works through a regulatory area of your brain that's responsible for your appetite. So just like when we are full, we've had too much to eat, there's a hormone that's released from our intestinal tract. It goes to our brain and it says, do not take another bite. If you do, I will hurt you. So it basically signals that I'm full, I need to stop. And that's what this drug mimics. And that's part of why it's so healthy. The other thing that it does is it increases metabolism. And it does that by increasing sensitivity to insulin and all the hormone pathways that are involved with regulating our blood sugar, which is our fuel for our body. It optimizes that. So that's the mechanisms. It does delay gastric emptying. It does decrease motility, which can lead to constipation. But the first two things I covered are the primary reasons it works so well and is so safe. So getting into safety, you signed some information about some very rare problems that can happen. The good news is that those rare problems are extremely rare, especially like pancreatitis. I have not seen a case of that. I've talked to numerous doctors that are prescribing these medications. They have not seen it. I've talked to specialists. They have not seen it. So when I first started prescribing this in 2022, when I opened this clinic, that was my main concern, was how often was that problem going to show up, and it's incredibly rare. It showed up in studies, 1 in 100,000 or so, but not a big deal. It's a big deal if you're the rare one that gets it. It's a bad problem, but it is very, very rare. It would be rare like having a severe allergic reaction to penicillin or having a routine procedure that goes bad. So I want you to be aware of it, understand that it can happen, but it's not expected with any frequency. The main thing that we see and deal with and caution you with is constipation. That's why you got to really push your fluids. If you already have a tendency toward constipation, you need to start Miralax right away, daily. And then if it seems like, it's causing you to be somewhat soft, then you can kind of gradually wean possibly off the Miralax. But we do not want you to get constipated. That's the number one thing that we see. Nausea can happen within the first day or two. We try to start your dose and increase your dose in a way that this is minimal, but if it's something that you're having trouble with, make sure you discuss it with us. We wouldn't want anybody to discontinue the program because they just feel like it's too big of a hassle and they're not seeing the results they want to see. We need to have some communication. We want you to be successful, and there's no reason we can't adjust the dose or change to the other version from semaglutide to tirzepatide, which tends to have a lot less side effects. Rarely do we have to take somebody off that medication. I don't think I've had to do it yet. I've occasionally had to take some people off semaglutide either because of tolerability or just lack of effectiveness, but most people it works very well for. Okay, other side effect issues that we can deal with. So just like it can really shut down your appetite, it can shut down your thirst. So you can go a lot longer during the day without even realizing you're thirsty, and you can get dehydrated. So really making sure you're drinking fluids frequently, that your urine is staying a light yellow color, that you're going at least 5 or 6 times a day. That will ensure adequate hydration. Protein intake needs to be around 100 grams a day, and here's why. You're going to lose some muscle. Studies show 20 to 40% muscle loss. It's normal with weight loss of any kind, but it is exaggerated with the shot, and we want to minimize muscle loss. So 100 grams a day is kind of hard to do. So think about it. That's 5 steaks a day, 5 chicken breasts a day, 5 protein bars a day. And obviously you're not going to eat that, but it means that you can't skip a meal. You need to prioritize protein. Then when you're almost full on your protein, you go to vegetables. Fruits are last. Prioritize protein. What we're trying to do is augment a healthy lifestyle. And what I have found with this medication, being on it for over a year and a half, is I have never eaten more healthy. So it's going to empower you to eat healthier, make healthier choices. You're going to get better results if you're already in the gym. Exercise is not required, but it is encouraged for toning. And again, it also helps reduce muscle loss. So for those that are frustrated because they're doing everything that they should be doing, they're trying to eat healthy, they're working out, killing themselves, and they're not losing weight, you will start seeing results. That's one of the most satisfying things about being involved with treating patients with this medication, is to see them be successful and to get unstuck. So that's awesome. A couple other things that we want to cover real quick is that there's an increase in fertility. And so one of the slides that we'll show you says Ozempic babies, and this was in the magazine Life in early 2024. And so people that have tried to get pregnant, tried to conceive, and have given up, they're finding themselves able to conceive. And we've known for decades that the primary cause of infertility is insulin resistance, which we've used diabetes medication for that called metformin for a long time, and it was pretty successful. Well, this is 10 times better than metformin. So understand that there's increased fertility rate. There may be a decreased effectiveness on birth control, especially when this medication semaglutide, tirzepatide is first started or the dosage is increased, so you need to kind of be aware of that. Because of the delayed gastric emptying, 1 week prior to a surgery or procedure, you need to hold the medication. So you're going to want to time it in a way that when you go into that procedure, surgery, it's roughly a week from your last shot. And just let the anesthesiologist know that you're on the medication. In lab work, if you've had any kind of lab work in the last 2 or 3 years, I would like to review that. We usually don't need to do new lab work, but I do like to review your thyroid and just anything that you've had done. I don't do a lot of lab work for this, but I do like to check a couple of things, roughly about 6 months and then annually. And you can do that through your primary doctor, and I can just tell you what to order, or we have a very fair price on lab work, and we're usually cheaper than going through your insurance. Okay, let's cover maintenance. Maintenance is different for everybody, and we will try to get that arranged for you in the most cost-effective way, and it looks different for everybody. I started the shot in 2022, and initially I thought that once I had been on it long enough that my behavioral patterns would change, my metabolism would change, and that I might be able to maintain it without the shot. And what I have found is that's not possible. Most people, it is not possible. Statistically, the studies show that if you stop the shot within 2 years, you're going to regain 70% of the weight. So why does that happen? I think it happens for the same reason that we're overweight to begin with. If you look at dieting and people trying to lose weight, a lot of people can lose a significant amount of weight for a short period of time. 4 to 6 months, a year, they can muster up the grit and determination to lose the weight. But then they drift slowly back. They begin to slowly slack off, or their eating habits slowly change, and they wind up right back where they started. We know this, everybody knows this. Our food is way too addictive, way too many additives and preservatives, and it's just really, really difficult to maintain off the shot. But it doesn't mean that you have to stay on the shot every week. Some people do it every other week, every third week, and we'll just work with you on that. Everybody's different. So, lastly, I would like to cover kind of me and my wife's experience with this, because it kind of goes to show how this drug works. So in 2022, when we started it, we started the same dose. I lost a pound a day for the first 2 weeks. I was an overeater. I was taking in way too many calories. And so for me, especially men in general, their metabolisms are usually okay. I just needed to close my mouth and keep it shut and take in a reasonable amount of calories, and that's what happened. And I had rapid weight loss. Within 6 months, I had lost 55 pounds. A year and a half later, I'm maintaining a 60-pound weight loss. My wife, on the other hand, she had a perfect diet, always has, had a perfect workout schedule, did all the things like Orange Theory and very intense daily workouts, could not lose weight. She only lost 3 pounds the first month. Second month, we went up on our dose a little bit, and she lost, I think, between 5 and 7 the second month. And again, we had both been trying to lose weight unsuccessfully for 5 years. So hers was purely a metabolism/hormone issue, and she's been able to maintain roughly about a 30-pound weight loss. Again, has to stay on the shot. She does hers roughly about every 2 weeks. I want you to know up front that in order to maintain the weight loss, you're gonna have to do a maintenance plan. If you only need to lose 5 or 10 pounds, you might just be able to do a tune-up once a year. But most of us are gonna have to stay on this drug lifelong. And studies show it prevents heart attacks, strokes. It's in the future of the next 2, 3, 4 years, hopefully as insurance covers this better, it's gonna be incorporated into every facet of disease management. Right now it's indicated for heart failure, coronary disease. They're doing studies on fatty liver, which is the most common cause of cirrhosis now. It will be used for sleep apnea. People will be able to get off their CPAPs, hopefully. High blood pressure, high cholesterol. Lots of people are able to either cut their blood pressure or cholesterol medications down significantly or get off of them. So it's, again, not just a weight loss drug. It's a metabolism drug, extremely, extremely healthy. So I know we covered a lot of ground. We've got written materials to cover this as well. It's a privilege to have you in the clinic today and to have you under our program. Please communicate if you're having problems, you're frustrated, if you're not seeing the weight loss as quickly as you thought. We want about 10 pounds max per month. Some people are going to lose 5 to 7, some people are going to lose 12 to 15, but 10's about right. And just let us know if you're frustrated, constipation, anything like that. Communicate with us, even if it's after hours. We've got a emergency line for after hours problems and questions as well. Again, thank you, and look forward to meeting you soon.